Well, good morning, everybody. Good morning, good morning, good morning. Thank you all for coming out this morning to participate in this CURV meeting. So we operate from 4 different pillars, which one is education, the other one is the influencer action team, the network action team, and the research action team. And we've been trying to get a communications action team. So those are the areas that we work from as far as CURV is concerned. I would like for those who have been engaged with CURV from the beginning and had led a team to at least stand up, raise your hand so everybody can know who you are. Thank you. Now, Dr. Lauren Magee is going to present to us. She's going to take 15 to 20 minutes, and she says she can go all day because she loves research, and I know that she does because I'm always getting a call, hey, I got an idea. Let's research this, let's research that. And I really enjoy working with her. So she's going to be up in a minute to share about addressing community firearm violence here in our city. I want to say thank you to our councilman, Brown, for being here, and our prosecutor Mears for being here as well. So what we'll do now is we'll have Lauren come up and present, but Lauren and I met back when you were doing your Ph.D. work. Yeah, and so we met through one of the IMPD officers some years ago, 6, 7 years ago, and she's been doing research ever since around the community gun violence, and so we've had the opportunity to do some work together. And so she has an extensive background. She's been presenting different conferences across the country and those kind of things, and just continue to work hard at trying to get us the information we need so that we can be informed about the work that we're doing and better do the work that we do. So with that said, I'll have Lauren come up and present.
Good morning. Morning. When Anthony asked me to do this a few weeks ago, I was like, sure, I can come present. Thought it would be like a small group over coffee, donuts. This is a little bit more formal, but that's all right. I can do it. So, as Anthony said, I've done this work for quite a few years with him. Before that, I've been in this space, specifically within Indianapolis, for about 15 years. So for those of you who don't know me, I know there's many familiar faces that have heard my story, but I started this work actually as an analyst with IMPD back in 2008, 2009, working within the cold case homicide unit, understanding really the impact that violence has on families, even decades later. Through that work, I then transferred to be a crime analyst, and during that time, most of the focus in the city was still on homicide victims. This is 2012, 2013. Noticing that many of our homicide victims had been previously shot and survived, and we weren't thinking of that as an intervention point, much less we didn't have data on non-fatal shootings. Now you hear data on non-fatal shootings all the time. We've developed that as a city and as a police department over the last 10 years. So that's primarily where my work sits, is in non-fatal shootings, understanding the health implications, the health outcomes of families and survivors of gun violence, and what that ripple effect looks like in communities. So Anthony asked me to talk for about 20 minutes. Again, I am an academic, so I could probably talk for 45 minutes to an hour, but I will not. Many of you understand the problem that we have in our community, so I'm just going to kind of walk us through some slides, give us some overviews, and then some pieces of my work that I think are relevant to think about as we talk about. I know you guys are really focused on the gun violence reduction strategy in the city. I will just say now, I'm not a part of that evaluation. I'm not doing any evaluation work on that project, but key pieces from around the country as well as different data pieces we should be thinking about as a city. So, any questions before I get started? No? Okay. So I just want to make sure we're on the same language page when it comes to firearm injuries, firearm violence. We hear a lot about it in the news. We hear the most about mass shootings, which are these big, high-profile mass shootings. There's different definitions of mass shootings that we don't have one set definition. It's typically 4 or more victims, potentially 4 or more deaths, depending on how it's defined. These are the least frequent, even though we hear about it the most in the media. Unintentional or accidental shootings, we've seen, at least on the news, that we've had an increase in the city around youth unintentional injuries. These are when a child typically gets a hold of an unsecured firearm and hurts themselves or a family member. If you move to the far left, suicide fatalities are actually the leading cause of firearm deaths in the country. This is typically older white men. States like Wyoming have the highest suicide rates. And then if we move to the intentional or assault-related shootings, or as I'll be talking about it today as community gun violence, that is where most of the non-fatal shootings happen, and these are the homicides and where this group is specifically focused. So just to make sure we're all on the same language page. Each of these have different root causes, potentially different interventions. They've always been kind of thought of as different buckets of gun violence, with the common mechanism obviously being the firearm. And this is not specific to Indianapolis, and I know this group is not specifically focused on children, but firearms are the leading cause of death among children 19 and under in the United States, surpassing vehicle crashes in 2019, 2020, and this trend has continued. This should be a shocking fact for everyone. I know I have conversations about this and people are like, there's no way, it's gotta be traffic fatalities. It's not, it is firearms. But we've taken a research public health approach to try to move more upstream to address firearm injuries. We've made car savers, we've done a bunch of other different interventions, we've done moms against drunk driving, we've not gotten rid of cars. So there are other approaches to take without having to talk about getting rid of guns to hopefully see this line of firearm injuries decreasing. And as a city, as a state, as a country, we hear the most about homicides, we hear most about firearm deaths, but for every homicide that occurs, this is same for Indianapolis, there's 2 to 3 non-fatal shootings. And the non-fatal shootings are important to look at because they continue the cycle of violence, what I'll talk about. And there's lots of unhealed trauma, physical disabilities, as well as higher healthcare costs and just higher trauma within the cities and families. So community gun violence is a multifaceted issue. It's not going to be solved with one solution, one intervention, one policy by any means. The social determinants of health framework really helps talk about many of the root causes of gun violence. Again, if we're thinking more upstream of how do we address and prevent injuries from happening, economic stability, social and community context, how communities interact with each other, how they respond to violence, how they interact with the police if they mistrust the police, neighborhood environment. This is even just the physical neighborhood environment. Broken streetlights, sidewalks, graffitis, greening vacant lots, healthcare, access to healthcare, huge disparities in access to healthcare, as well as education. So addressing these can also help us prevent firearm injury and a piece of the puzzle. So the data. Many of you have probably seen this. This is firearm injury data in Indianapolis over the last few years. It ends in 2023. The bottom line is our homicides. These are gun homicides. And the top line is our non-fatal shootings. Again, a lot more prevalent, 2 to 3 times as homicides. If you average it out per day, there's 2.5 people per day that are shot and survive in the city. When we think about the unhealed trauma and then all the physical and emotional implications that come with this. This line, if we include it at 2024, is starting to decrease some, but we are still not back down to pre-pandemic levels, which is how other cities around the country are trending. I think I just saw an article that, I think it was either Philadelphia or Baltimore, they just hit pre-pandemic levels of gun violence. And then if we look at the adult versus youth, I know this has been a big discussion in the community recently. I did a report that many of you may have seen on youth firearm injuries in the last year. Youth firearm injuries are increasing. They have been increasing over the last 2 years in the city. However, they are still a very small number of overall gun violence that occurs in the cities. It's still primarily adults, which is what the gun violence reduction strategy is focused on, that 18 to 24 year age range. The youth is still, in my opinion, important to focus on because, again, moving more upstream. How do we prevent these kids from, that have maybe been exposed to gun violence, from being the next kid who picks up a gun and uses it to deal with their unhealed trauma? The average age is about 28 of our gun violence victim in the city, which is older than most people commonly think of it as, but is actually a very common trend around other cities as well. And then we know, if we look at who's involved, that there's huge racial disparities and health inequities in where these shootings are occurring. They spatially locate in certain communities, and they have for a very long time. This map is an older map, but the darker areas are the census tracts with the highest rates of gun violence. Many of these areas will not surprise people that have been doing this work for a long time. And then if we look at the racial disparities, the majority of our victims are young black males. If you look at youth under 18, there's 9 times the higher rate versus white youth, and it's almost 20 times that of older black men. These data are from around the pandemic, which is where we did see gun violence disperse a little bit more than we typically see it. But how we have focused and how we focus the gun violence reduction strategy and how gun violence interventions have typically been focused is that it's a small group of individuals that are involved in the violence that is occurring in small areas around the city. So yes. Yes, yeah, that would be great to look into. But I believe it's the dispersion that happened during the pandemic. This, and I can speak further this is based on census tracts right now. If we look down to the even street level, so the dissertation work that Anthony was talking about that I did, look down to even the street block. And within these census tracts that we say are the highest rates of violence, it's specific streets blocks within even these areas. So it's very concentrated. Again, that was pre-pandemic. It's been on my list of projects to do to see if it's still that spatially concentrated now. And the cycle of violence. So there's a lot to say on this, but the piece that's important is that the community context matters in community gun violence. A shooting happens, a homicide happens, there's large mistrust in the police, institutional mistrust that exists. They're not willing to discuss what happens to have it solved. The need for retaliation. Anthony and I did interviews with young people in the last year, and the need for retaliation is high. They need to take care of their family and their friends. But retaliation shooting just leads back to another shooting. And it's this cycle of violence, and figuring out how to break this cycle of violence is one where my area of work has tried to sit, but is one of the most important pieces of the gun violence strategy within Indianapolis, to try to use those violence interrupters to stop a retaliative shooting before it actually happens, which is really hard work to do. It takes the right people, the right time, and the right knowledge to be able to do that because of this mistrust. It's not work that I can do. It takes someone that's a credible messenger to be able to do that work. So a lot of my work has, again, been trying to move more upstream, and it's not the piece of the gun violence reduction strategy, but is trying to address this unhealed trauma that exists within our community, intergenerational unhealed trauma that exists. Being a direct victim is associated with being higher rates of depression, anxiety, and PTSD. Living in a community, so living in one of those census tracts or on one of those street blocks that have higher rates of violence. Children specifically, but also residents in those communities, have higher mental health needs because of that exposure that they experience every day. And then even work that I've done looking at the children and a sibling of a survivor, specifically a non-fatal shooting survivor, they also have higher mental health needs. Their mental health needs are actually higher than even the direct survivor themselves following that shooting. And these are perhaps the kids or the people that we need to focus on the most, because they might be the next person, because of that unhealed trauma, that picks up a gun and becomes the next shooter. Unhealed trauma as well, I was just having a conversation, I am not a mental health provider, but I've done enough work with it now that unhealed trauma actually changes the brain of youth to the fact that they are not able to control their emotions with a rational thought to take that step back. And that's where a lot of that intervention works, and it takes that key interrupter to try to step that person back from using the gun as the solution, which is challenging. Anthony and I have these conversations all the time, so yeah. So the other piece that I did this work actually with Anthony and Beatrice is we talked to survivors of gun violence to ask them about their experiences. We were interested in mostly how they interacted with the mental health system, if they went to mental health services, how they addressed their trauma, did they emotionally heal from it? This is a direct quote from one of the survivors. We talked to 18 survivors, asked them about their experiences, and there were kind of 4 main themes that came up in these interviews. One, that the survivors, they didn't need help. They were fine. The shooting didn't impact them. Gun violence is so normalized in our community today that they physically healed and then moved on, despite describing every symptom of anxiety, depression, or PTSD if you gave them a clinical screener. Their unwillingness to talk, their fear of getting in trouble, making sure they didn't want to be a snitch or violate the code of the street, even to mental health providers. So we know it applies to the police, but even to a mental health provider, that they weren't willing to talk about what had happened to them because of that fear. And the need for credible messengers, the need for people like Anthony and others of you in the room with the violence interrupters that are part of the gun violence strategy, even from a mental health standpoint. There were a few survivors that did talk to someone that were connected through Prescription for Hope, and they were like, it wasn't useful for me because that person couldn't identify with my life, my experience, and the community that I go back to. And then the last thing that was the surprising piece, and is really where my work has continued, but is how concerned the survivors were for the impact their shooting had on their family. And I think this quote from one of the survivors really drives home that piece of it, and I can read it because I know it's challenging to read. It says, yes, because it impacts everybody. The more I'm impacted, it impacts my kids, it trickles down. You know what I'm saying? And then my kids are affected because what's affecting me affects them, and then their mamas, and then the mamas affect the kids. So we talk about one shooting, but it's that ripple effect that affects everybody, and the piece that we also have to think about. The other piece that I think is important to talk about is, again, these were non-fatal shooting survivors. Some had been shot 20 years ago. Most had been shot within the last 5 years. Us asking them about their experience from a research standpoint was the first time anyone had asked them about their experience. Anyone. Most left, I think half, said that yes, this is research, but they felt better being able to talk about their story because it was a confidential space, and they were like, this feels better. So that clearly the indication that there's some sort of need to discuss, have the counseling, whatever they want to call it, but they felt better just having someone ask them. The other notion that one of the survivors said is that nobody cares about us because we survived, because the focus is so much on homicides. I see Deputy Chief Adams just walked in. We've had that conversation too, that that's how it feels. Current interventions. Anthony asked me to talk about where's kind of the state of the work, what we're doing here locally, what's happening nationally. So there's a lot happening here locally, and there's a lot happening here nationally. And from a research standpoint of what works, we know pieces of what works. I think as at the state of this work in other cities, I was just having this conversation a few weeks ago with people who work in Baltimore, DC, in New Haven, Connecticut, that we're at a state where we have to now figure out how do we evaluate multiple programs co-occurring at the same time. And I can say that none of us currently have an answer of how to do that. Besides, the conversation is needed. So street outreach, this is a big part of the gun violence reduction strategy here. Group violence intervention, call-in models, also called the Boston ceasefire model, happens across cities in different capacities. I believe it is still occurring in the city right now. Hospital-based violence intervention programs. We have 2 here in Indianapolis currently. We have Prescription for Hope that has functioned and done this work at Eskenazi for almost 12, 15 years now. The idea being, if you're not familiar with it, the time that the patient is in the hospital is a teachable moment to connect them back into services, social services, emotional services, and make sure that they don't leave and retaliate. Some of the research that I'm doing with their medical director, Dr. Ortiz, we're learning that teachable moment works for some and not for others. The survivors at that moment are just angry, and they don't necessarily want to engage in services, so how do we re-engage with them after they've been discharged from the hospital? Methodist just started a hospital-linked program, which is the similar concept, besides it is using the Office of Public Health and Safety's life coaches as the person who goes in to try to connect with the survivor at the time of their shooting. Other cities, as well as us, have the crime gun intelligence centers, ShotSpotter, lots of debates around ShotSpotter of if it works, doesn't work, cities should use it, shouldn't use it. And then actually the best evidence we have in some of the cities of what works to reduce gun injuries is greening public spaces, changing vacant lots into gardens, shows to decrease through randomized controlled trials firearm violence in that area, which seems like pretty easy fixes. I know we've tried it in some capacities, and sometimes it works and sometimes it doesn't, but that's actually where, from a research standpoint, where the strongest evidence currently sits. And then with that, am I at my 20 minutes yet? Got a few more slides. I'm getting there? Okay, I'm getting there. So the other thing, which I could talk for hours about this, but to evaluate anything that's working, one program, multiple programs, you need data. If you've seen my talk before, you've seen my silo picture, because this is how our data sit in the city right now. The data that I presented today are IMPD's data. EMS, clinical data, trauma registry data, it's all connected, it all doesn't talk. I've done some of the linkaging in my research of how to get all the systems to talk to be able to have that comprehensive picture, but from how do we use that to address community violence, we have yet to address that. We've had multiple conversations with people in the room of how do we integrate this, how do we have those data agreements to have all the different agencies talk, to have this comprehensive picture. And then this, again, excuse the academic article, this was pulled from another talk, but is the media. We see most of the shootings that the media reports, and it sometimes use those data as a reliable data source, or if you're looking at national level data, it's the gun violence archive that people use specifically to pull non-fatal firearm injuries, because there is no national source on non-fatal firearm injuries. And the media undercounts the shootings that actually happen. So this study that I did actually compared IMPD's data to a open source data collection we did with all the news reports from Indianapolis. And the news reports, which despite looking at the news and seeing it on a daily basis, they don't really report on 2 out of 5 shootings that happen from a non-fatal standpoint. Yes?
FBI data doesn't capture everything shooting.
You're going to get me on a tangent. I'm already out of time. The FBI data from a death standpoint, yes. From a non-fatal shooting standpoint, it is there, but it doesn't always indicate if the person was actually shot. So it's an aggravated assault gun, but you can be hit with a gun, not necessarily just shot with a gun. NIBRS is supposed to be changing that through a recent executive order. It will be determined if that executive order stays. And then the media is biased in what they report, not shocking to many in this room. Child victims, they're always reporting, as well as multiple victim shootings. If more than one person's shot, it's making the news. So what's next? This is the part you really want me to talk about, Anthony. This is my slide for what I did at 5 a.m. this morning, so excuse the not prettiness. But so what's working across the country in community violence intervention, or as we're referring to the street outreach, the research is mixed at best of if it's working or not. And that's because it's challenging from an evaluation standpoint, because little data exists around it. If we look at it from a community level, did these communities that violence interrupters work in see a decrease in arrest or shootings? From an arrest standpoint, we can see that arrest went down, not victimizations from Philly and Baltimore. There's some indication, again, in Chicago and Denver that it's working, but there's still more work to be done. And that, again, is where the state of the conversation is locally here, hopefully, as well as nationally, of how do we collect the data from the violence interrupters? How do you have someone who's out, hopefully preventing the next shooting, then collect the needed data that we can go back and evaluate that. as well as the ecosystem of gun violence reduction. There's a lot of different programs happening here. How do we understand which program's working, which piece of which program, or if it's as a collective, all the programs working? That is yet to be figured out. So, okay, I'm now done.